Welcome to another episode of Influences in Dentistry. I'm Dr. Geeta and I'm excited to share the inspiring conversation with you today. Let's dive in and learn from another amazing dental professional. Hi, I'm Dr. Geeta Perks. I'm the CEO of Dental Focus Marketing, and I'd like to welcome all of you to our new series called Influences in Dentistry, where I have conversations with really inspiring dentists about their journeys into dentistry and dental education. And it's not just to satiate my curiosity, but I really believe that as dentists, we have our unique stories to tell and to share with our profession. And I'm not talking just about the successes that we've had, it's also about the challenges and how we've overcome them. And I really hope that this is going to inspire people in our profession to learn, to grow, and hopefully take dentistry to the next level. So I'm delighted to have Dr. Donny Mandrawa here with me today. He's taken time out from his busy 4-day lecture here in Melbourne. He is a dentist and he graduated from the University of Melbourne in 1998. He runs 2 practices, the Myofunctional Centres, and they're in North Balwyn and North Melbourne. He educates internationally under MyoFocus Education. And get this, he is a general dentist, but he doesn't do any general dentistry. So I'm really curious about that and how you've navigated that. So thank you, Donny. Thank you for joining me today and having this conversation.
Thank you so much, Geeta. Thank you for inviting me. And yes, don't ever ask me to do a filling because I'm not good at it, yeah, even though I am a general dentist.
Okay.
Yeah.
Okay, we will come to that. So I want to go to the very beginning, the young Donny, entering into dentistry, and who or what inspired you to become a dentist, and what did that journey look like for you in the early days?
Sure. Well, I graduated from high school in 1993, and I was always interested in the medical field, I suppose, because I have a family background of doctors and dentists, and my mum was actually a dentist. And when I got my results from high school, I actually got 2 offers, which is dentistry and science law, and I was like, what am I supposed to choose, right? All my friends said dentistry except one, because he got into science law as well. So it was almost like a natural choice for me to get into dentistry. And to this day, I actually feel very fortunate that I have chosen this career, because I have been able to make it into more of a rewarding career, not only for myself, but in terms of how many patients we have helped over the many years, especially making the type of dentistry that is quite niche now, yes. Not just really general dentistry anymore, what we do at our clinics. Yeah. And that has really been taking things to the next level, I suppose. Yes. Yeah.
Still on the early days, I have read that you did some dental volunteering, and do you think that shaped how you approached patient care very early on?
It certainly played a factor.
Or was it your mum?
I think the patient care was more in terms of life experiences. My father actually passed away when I was 14 years old, right? Yeah. And in a way, I never really had a father figure since I was 14, and that really shaped the person that I am, Yes. In a way, my mum and I had to survive. I'm an only child as well, and had to keep moving, I suppose, and all the struggles that we went through in the early days really motivated me and built my determination, I suppose, to make sure that my family eventually is going to be okay. Yes. Yeah. So the volunteering work, which I did in 2002, definitely played a role, because I got to experience a lot of things. It was in North India, and we were treating Nepalese orphans, basically.
Oh, wow.
And in that 3 weeks worth of volunteering, trying to do dentistry with the most basic equipment and instrument you could ever imagined. Like, patients were basically just lying down on a bench somewhere on the side of the street. It was an amazing experience because all these orphans really appreciated what we do.
Yes.
And it just shows that it's not about what you have, but it's about what you are inside. And that's, I think, is very, very important. Because especially in the type of professions that we are in, where we are helping so many people, it's not about teeth and gums. We are actually helping human beings, right? So I think that is one focus that a lot of health professionals need to really understand, that there is a human being with every one of our patients, basically.
Well, that's amazing. So then you drove your interest into orofacial myofunctional therapy.
Yes.
And do you think that has shaped your practice and your philosophy in dentistry? And actually, for our audience who don't know what myofunctional therapy is, could you share that with us?
Sure, of course. So orofacial myofunctional therapy is actually quite a special part of dentistry. Orofacial means mouth and face, and myo means muscle. So functional just means the way the muscles of the mouth and face are working. And in dentistry, we can implement these modalities in terms of helping patients to develop their jaws, to help them breathing well, sleeping well, to help with temporomandibular joint dysfunctions, to focus on their airway health, and so on. And orofacial myofunctional therapy is basically an exercise-based type of treatment, in which a lot of my patients basically undergoing exercises for the muscles of their mouth and face. I say to my patients, it's like going to the mouth gym, right? Because when you go to the gym, you get exercises, you get equipment, like you get treadmills and exercise bikes and so on, exactly the same as what we do. So my patients get mouth gym equipment, right? And they get exercises, and our orofacial therapists are like their personal trainers. So it's a bit like that. And then if we are able to get all the muscles of the mouth and face posturing and functioning well in a healthy state, that's when everything else is going to follow, because the mouth is actually a very, very important part of the body. And the tongue especially is one of the strongest muscles in our body. And if you think about it, when a baby is being developed in the tummy, the first muscle that develops is the heart. The second one is the tongue. That's how important the tongue actually is. So it plays a big role in terms of how children grow, in terms of how the brain grows, and so on. So we treat as early as we can. Like my youngest patient so far is like 2 days old. And my oldest so far is 74 years old, in which we can do orofacial myofunctional dentistry.
Fantastic. It's so insightful. Then you started going into education. So did you feel that there was a gap in the education that what was so exciting for you to want to do this?
Sure. So my first myofunctional patient was in 2001, and back then I really didn't know what I was doing. I was still new at it, and through all the years where I've started to learn more and more about myofunctional dentistry, I was actually learning a lot not from dentists. I was actually learning a lot from speech pathologists, chiropractors, osteopaths, lactation consultants, and so on. So I wasn't really going to a lot of dental courses per se.
So was that because you felt that the dentists weren't really teaching that?
I feel the connection's not there between dentistry and the rest of the body, right? Because teeth, gums, jaws, they are actually part of your head, and the head sitting on the rest of the body. So to understand that connection is very important, and unfortunately tertiary education taught us that that all these systems in the body are separate, and they really fail to recognize the interconnectedness, right? I think it was Albert Einstein who said that don't let education be the barrier of your learning. Which I think is very, very important, because you've got to learn how to treat the whole human, and it's not just about the mouth itself. However, as dentists, yes, our scope is here, and we've got to make sure that we do practice within our scope, and we need to collaborate with other professionals regarding how to manage the whole humans. And that's where the education comes in, because after learning for so many years about this interconnectedness of all the systems, I feel it's important to try to get a lot of more dentists actually to understand this, right? Yes. And in terms of orofacial myofunctional type of treatment, I believe we're probably, Dr. Dan Hansen and I are probably the only two dentists that are actually teaching it from a dentistry point of view. Yeah. I mean, look, there are speech pathologists, dental hygienists that are teaching orofacial myofunctional therapy. But I think we're the only two dentists that are teaching it from, you know, a dentist point of view.
It is rare.
It is rare. And I do get a lot of families who's been through quite a long journey, and then they finally find our clinics and feel that, you know, they finally find an answer, which is a very, very common story in my opinion. And it's not because they have been misled or they have been told the wrong thing. It's because a lot of the practitioners that they have seen in the past just didn't know it, right? When they don't know, obviously they're not going to say anything, and they just say everything's fine. But I think that's why the education is so important, because the more people understand it, the more people are going to be able to get help. And it doesn't mean that when you learn about this thing, it doesn't mean that you have to do it, but if you understand it and you know how to direct your patients, I think that it's going to be very powerful for your patients and their families.
That's so true. You're a busy bee. You know, you own two practices. So how do you find the time? And also, did you have any challenges with setting up your practice and then running the practice, as well as, you know, doing your education? But how was that journey for you for practice ownership?
Sure. I've set up 3 practices from scratch. 2 of them with a business partner, and 1 of them was by myself, right? I now run 2 of those 3 practices by myself. And there's always challenges, and I think the challenges is what keep people alive, I suppose, and keep people motivated. And it's not an easy path from the beginning. Obviously, you've got to try to build up your clientele and so on. But I believe the one thing that really works in any business is to have a point of difference. And the niche that I have found, which is orofacial myofunctional dentistry, is the point of difference. So that's why we managed to build the practices up very rapidly, actually, and we have patients from interstate and overseas and so on. And then it's all about being organized and having systems and protocols, because I know that when I'm here lecturing, the clinics are actually still running. You know, we have 5 dentists and 3 oral health therapists now, and a team of like about 22 people, you know. So they're still running, because, you know, people are still getting help by the clinics running. And it means that, you know, I can still educate, but also patients are still getting what they need. And it's all about scheduling, having that systems and protocols, as I said, because being organized is what's going to really be the key of making sure that the teams continue on operating.
So the pain point that you had, was there any particular pain point that you had along the way that you feel like you've really, I know you've overcome them, but what were they? What were the...
I think because my first 2 practices were general dental practices. One challenge was transforming them into orofacial myofunctional clinics, right? And there were a point of time where there was a mixture of the myofunctional dentistry and the general dentistry. And what's difficult with that is that the team has to put 2 different hats on. And that's really tricky. So I think if you're able to focus on one particular specialty in a way, that's what's going to really make it well, because it took me a while to be able to focus it into myofunctional dentistry from general dentistry. I feel it doesn't work if you try to do everything in one clinic, right? Because if you can imagine, one patient calls up going, I've got a lost tooth, and then the next patient calls up and say, my tongue is tied, right?
Yeah.
The receptionist is going to go, wait a minute, I got to think differently now from one to the next. And often when there's too many things going on,
Yes.
that's when the message gets lost.
That's right.
So focus on one thing, and you don't have to be good at everything, basically.
Yeah.
I think if you're good at one thing and know how to direct and guide patients to get help from more appropriate practitioners, that's really going to help. Yeah.
I think that's a key point, you know, figuring out what your niche is,
Yes.
and then homing in on that.
Yes.
And that's what we tell our clients all the time. So you've done well there. Let's talk about myofocus education, because you are teaching internationally. I know you're teaching here in Melbourne, in Australia, but you've gone further afield. Like you've gone to Malaysia, Japan, you've gone to the States, and recently you're in South Korea. So tell me more about that, and the exciting things about that.
Yeah, well, myofocus education was created by myself and Dr. Dan Hansen. And this was, I think, 8 years ago now, just a little bit more than 8 years ago. We've been very fortunate that we've been able to educate globally in a way. We did start from Australia, but then I think because, you know, there's not many, as I said before, in terms of myofunctional courses from dentists. That's how we got the invitations. And we got invitations to go to Japan first. We did quite a few lectures there. I think one of our biggest lectures in Japan, there were like over 180 dentists present in the room. And then we got invited to Malaysia, and we've done like about, I think, 5 or 6 different lectures in Malaysia now, all about, you know, 2 to 4 day programs. And then we've done some in USA as well. And we've also been invited to like conferences and things, you know, which is amazing because the words are getting out there. And both Dr. Dan and myself are very passionate about education, because, as I said before, it is very important that for people to really understand what's going on here, because this is treating holistically, as you said, you know, the whole human body. And I think the more people that can understand this, the better. So we actually open our education not just only to dental practitioners, but also ear, nose, and throat specialists, speech pathologists, lactation consultants, chiropractors, osteopaths, physiotherapists, sleep scientists have actually attended our courses. But one of our biggest thing now is that we've just done our first myofocus symposium in Melbourne about 6 months ago, which was unexpected success. Basically, we sold out 2 months in advance, and now we're having our second one in Kuala Lumpur, Malaysia. So we're going international with our symposium, which will happen in May 2025. And it's going to be combined with the Integrative Airway Summit, which is an ENT meeting. So it's really taking integrative approach to the next level, because our speakers are not just dentists or doctors, but also you know, speech pathologists, chiropractors, lactation consultants, behavioral scientists, and so on. It is. And when you are in this space, you do have to work with a lot of these professionals as well. Because when, you know, I can only treat the mouth and face, but someone else has to treat the posture, someone else has to treat the nervous system, and even the psychological state of the patient sometimes, you know. But having that approach is what's going to really help the future generations, and that's why we treat as early as possible. It's best to treat while they're still growing, because they are still adaptable to it. You know, once you've come to my age, I'm not growing anymore, I'm probably shrinking now, Geeta.
Me too.
Yeah, you too.
Getting
Yeah, there you
go.
But you know, once you have completed growth and you're not as adaptable anymore, you end up just treating the symptoms and never really getting to the root cause. But if you can prevent things while they're still growing, they're probably going to be much better once they stop growing.
Absolutely.
Basically.
That is incredible. So my next question is, okay, let's say we've got a young dentist out there, or we've even got a general practitioner who's thinking about bringing in myofunctional therapy into their practice. Like, what are the skills that they're going to need? What are your top tips for them?
Sure. I think have an open mind. That's the first thing that you got to have. A lot of new graduate dentists, because they're fresh from university, of course they still have that, academic recipe book type of mindset. Tunnel vision, exactly right. You really got to think outside the box, right? Because if you limit yourself in that box, limit yourself with the teeth and gums and the mouth only, you're going to limit your own professional growth and your own personal growth. So having that open mind and looking for continuing education that's going to teach you about the whole body is what's going to get you started. So I recently employ a new dentist as well, who never really had experience in myofunctional dentistry, but he was thinking, I don't want to be stuck as a general dentist for the rest of my life. I've got to think that there must be something out there, he said, that can help me to help my patients more. So he came across myofunctional dentistry and he got really interested in it. He started to do his own research and everything. And then my advertisement came up that I was looking for a dentist. So it was like the universe just opened up for him, which is awesome, because having that open mind, it will lead you to places that you probably never thought you would go,
Yes, it does. And it's a wonderful thing. My next question is something that really excites me, and it's about the future. And if we had this crystal ball that's in front of us, what do you think that the future of myofunctional therapy, airway-centric approaches are going to be?
I think we have just scratched the surface at this stage, Geeta.
Right.
And the layers of the onions is very thick, right?
Yes.
I think there's a lot more to airway dentistry and myofunctional dentistry, because there's more and more things that I'm even learning right now that I feel, wow, that's like part of the missing piece of the jigsaw puzzle. See, I have this puzzle when I teach, and the puzzle gets bigger and bigger and bigger, right? For example, I'm now starting to think, do we have to look at the mother before they even conceive?
Wow.
Because what is going on with the mom's health condition, for example? Imagine this baby is growing in the mother, and if the mother has sleep apnea or not sleeping well, research shows the baby is going to have sleep issues as well. Lack of oxygen and so on. So we've got to think, even further beyond and before. All these effects of airway issues and narrow jaws and so on, I wouldn't be surprised if the root cause actually began 2 to 3 generations before us, right?
Wow.
So we are only scratching the surface at the moment.
And I think that's fantastic, because when you stop thinking outside and or you just say, I've got it, that's when there is no more growth, is there? So
absolutely. And you want to keep growing. I don't think there will come a day where I don't learn anymore. There's always something new.
There is always something
amazing. New.
What motivates you? What keeps that fire burning inside? Like, Donny, what is it? What is it? Because you're so busy. What keeps you going?
I think my kids and wife have really kept me going, like very well. And, I've got 2 kids, they're 17 and 15 now. They're not terrible kids. Don't show this video to them.
There's no bias in that at all.
No, of course not. But I do believe that, both my girls actually had a tongue tie. And I didn't know anything when they were born, right? So I do believe that the future generations is very, very important, because, see what this world is coming to. Everything, all these new technology, all these processed food, people not chewing anymore, people are getting narrow jaws, airway issues, breathing dysfunctions and so on. We can change that, right? I've got a very close friend who's a chiropractor who says, it's doom. We just got to burn everything and start again. Well, probably it's not doomed, right? I think if we have the right people who can direct the future and guide the future into a better place, I think that's very, very important, and that's really motivates me quite a lot. Yeah.
That's very good. If there's anybody out there that's wanting to know more about your referral centres, that's also wanting to know about your courses as well. So where do they go and look for that? Do you have a website or social media handles?
Sure, we have websites and social media handles as well. Websites will be the myofunctionalcenter.com.au. That's the website of my 2 clinics. We also have myofocuseducation.com, in which is the platform that we educate from. And I also have the social media handle at Dr Donny Mandrawa. I've got a public page on Instagram and Facebook. I do share a lot of my life journey and before and after cases, case studies, and so on. So it's not just all about science and work, but I think it's very important to be able to embrace
life,
the whole humanity.
Right?
Life, exactly
life.
Right.
That's so true. Well, I feel like I've learned a lot about your journey, Donny, and I hope that people in our profession will find that inspiring, so that they will want to learn more from you, because you are full of knowledge. And thank you so much, and I hope that you keep doing that amazing work that you're doing.
Thank you so much. Thanks for inviting me again, Geeta. And yes, I hope I can inspire people, but everyone always inspires me every day as well, which is really the main thing. Thank you.
And as Dental Focus Marketing, we're continuing to support you, and looking forward to the future.
Great, likewise.
And thank you so much for taking the time to connect.
Thank you again.
Please note, the views shared are personal to our guests and not official advice. All treatments carry risks. Consult a qualified health practitioner to determine if a treatment is right for you. For surgical or invasive procedures, seek a second opinion from an appropriately qualified health practitioner. Always consult a licensed health professional for your specific concerns.